Picture your body as a bustling city, with blood vessels as highways delivering vital supplies everywhere. Two major problems can quietly develop: high pressure in these highways, hypertension, and delivery trucks unable to unload their cargo, high blood sugar or type 2 diabetes. These are called silent killers because they cause damage for years without obvious symptoms. You might feel fine, but inside, high pressure and sugar are slowly eroding your body's critical systems. By the time symptoms appear, serious damage may already be done to your heart, brain, kidneys, or eyes. Ignoring high blood pressure is like ignoring your car's warning lights. Everything seems fine until a breakdown happens. Unchecked high blood sugar is like termites eating away at a house's foundation. Damage builds up unseen. The key is understanding these conditions before a crisis hits. Knowledge lets you make informed choices about your diet, activity, and medical care. Managing or preventing hypertension and diabetes starts with awareness, not just prescriptions. Recognize these silent threats and take control, turning a story of hidden risk into one of healthy living. Your health journey begins with understanding, empowering you to protect your body for years to come. To grasp hypertension, let's first understand blood pressure. Your heart is the city's pump, arteries are pipes, and blood pressure is the force pushing blood through them. This pressure is vital. It ensures every cell gets oxygen and nutrients. Blood pressure is measured as two numbers: systolic, when the heart beats, and diastolic, when the heart rests. Think of a garden hose. Too little pressure, water trickles. Too much, the hose strains or bursts. Healthy blood pressure keeps everything flowing smoothly, adapting to your needs, rising with exercise, falling at rest. Problems start when pressure stays high, even at rest. Constant high force strains artery walls, putting the system out of balance. This is hypertension when your arteries are under relentless pressure, even when you're not active. Over time, this silent strain wears down your body's infrastructure. That's why monitoring and managing blood pressure is so important. It's about keeping your body's highways safe for the long haul. Hypertension comes in two main types: primary and secondary. Primary hypertension is most common. No single cause, but a mix of genetics, aging, and lifestyle. Risk rises with family history, age, high sodium diets, stress, inactivity, alcohol, and smoking. It's like slowly turning up the pressure on your arteries over years. Secondary hypertension is less common and caused by another medical issue, like kidney disease or certain medications. Treating the root cause can often resolve secondary hypertension. For most, managing primary hypertension means focusing on lifestyle, diet, exercise, and stress. While you can't change your genes, you can control many risk factors. High blood pressure silently damages your body's vital organs. The heart works harder, thickens, and can eventually fail. Arteries get damaged, leading to plaque buildup, heart attacks, and strokes. In the brain, weakened vessels can rupture or get blocked, causing strokes and memory loss. Kidneys suffer as tiny vessels scar, leading to chronic kidney disease or failure. Damaged kidneys can't regulate blood pressure, creating a vicious cycle. Even your eyes are at risk. Hypertension can cause vision loss by damaging retinal vessels. The damage in your eyes often mirrors what's happening in your heart, brain, and kidneys. Now let's look at type 2 diabetes. When you eat carbs, your body turns them into glucose, fuel for your cells. Insulin, made by the pancreas, acts as a key, letting glucose into cells for energy. After eating, insulin helps move sugar from your blood into your cells, keeping blood sugar in check. This system is finely tuned. Too much sugar in the blood is toxic. In a healthy body, this cycle keeps energy steady and organs safe. Problems start when this balance breaks down. That's when type 2 diabetes begins to develop. Type 2 diabetes usually starts with insulin resistance. Imagine insulin as a key and your cells as locked doors. In resistance, the locks get rusty. The pancreas makes more insulin to compensate, but over time, it can't keep up. For years, blood sugar may look normal, but the system is under strain. Eventually, the pancreas tires out, producing less insulin. Now you have two problems: resistant cells and not enough insulin. Glucose builds up in the blood, leading to chronic high blood sugar. Hyperglycemia. This is the tipping point: full-blown type 2 diabetes. The body's compensation fails, and damage from excess sugar begins. That's why early detection and action are crucial. Type 2 diabetes develops from a mix of genetics and lifestyle. Family history and certain ethnicities increase risk, but lifestyle often tips the balance. Being overweight, especially around the abdomen, is a major driver. Fat cells fuel insulin resistance. Staying active helps. Exercise makes cells more sensitive to insulin and helps manage weight. A sedentary lifestyle and unhealthy diet, high in processed foods and sugars, worsen the risk. Over time, constant demand on the pancreas leads to fatigue and diabetes. On the flip side, a diet rich in fiber, lean proteins, and healthy fats supports blood sugar control. Small, consistent changes in activity and diet can make a big difference. Prevention is possible with the right choices. High blood sugar acts like a corrosive agent, damaging blood vessels throughout the body. Large vessel damage raises the risk of heart attack and stroke. Tiny vessel damage causes diabetic retinopathy, vision loss, and nephropathy, kidney failure. Regular eye exams can catch early signs of damage. Kidneys lose their filtering power, leading to chronic disease and possible dialysis. High blood sugar also harms nerves, causing pain, numbness, and risk of infection, especially in the feet. Poor circulation and nerve damage can lead to severe complications, even amputation. Controlling blood sugar protects your entire body, not just your numbers. The risks of hypertension and diabetes are real, but so is your power to act. Both conditions are manageable, and type 2 diabetes can often be prevented or reversed. The foundation: healthy eating, regular exercise, and when needed, medication. Choose whole foods, lots of vegetables, lean proteins, and whole grains. Cut sodium for blood pressure. Control carbs and sugars for diabetes. Aim for at least 150 minutes of moderate exercise weekly. Consistency matters most. Even small changes like walking more add up. Regular checkups and medication, if needed, help you stay on track. Modern treatments are safe and effective. Using them is a sign of strength, not failure. By understanding these silent threats, you become the captain of your health. Take charge now for a healthier, longer life.